Hello. Thanks for taking some time today to learn about how your benefits matter. As part of the Home Furnishings Association, powered by Decisely, we're able to offer you guys some group benefits that you have not had access to before. My name is David Ainsworth, and I am the VP of Enterprise Sales at Decisely, and I am in charge of the program with the HFA to bring you guys these benefits that you haven't had the opportunity to take part in. I've been in the business for the better part of 20 years, and my career has been focused on the small business and trying to help them find solutions similar to what a Fortune 500 company would have, but being able to bring that to folks that have not had the access to in the past. Here's why this is important. You, as an employer, know that it takes time and money to hire and train new folks. We have found that being able to offer a comprehensive benefits package that includes dental and vision and healthcare is definitely a recruitment tool that helps you all be able to run your business without having to worry about trying to backfill positions for people that don't stick around. What's also important to your employees is that when they look to come to a new business, when they're looking for jobs, we've done some research and we've done this across multiple industries, and we have found that the majority of employees actually believe that a comprehensive benefit structure is just as important as their salary is. So in order to attract and retain quality talent, it's always good to have those additional benefits that you can offer them. As I mentioned, like I said, it's a strong recruiting tool, but health insurance isn't about just not getting sick. It's about staying healthy. And we have found that some of the plans that I'm going to review here in just a little bit, that there's a different idea in healthcare. A lot of folks don't go to the doctor because it has an out-of-pocket cost associated, even if they have insurance. And they'll avoid going to the doctor or taking care of those normal maintenance things, and then they fester into larger problems later. As a business owner, that can cause problems for your workforce, but then also as the members, it's detrimental to them because they may have a large claim situation that they're not able to afford later on. As it states here, it's about the retention. So if they're healthy and happy and you guys have a strong benefits package, we have found that employees tend to stay with their employers more than twice as long. So that's important because as you guys are going through running your business, you don't have to worry about replacing them and hiring a new person and training a new person and taking away from what you do best. Something to think about, this is kind of an average annual, but it costs the employers about $12,000 a year per employee. Now, that's a pretty big sum considering that the majority of benefits that are offered to folks, people aren't taking advantage of. A lot of times an employer will say, I'll just provide them this benefit or this option and they can take it or leave it, which leaves the member not having the coverage that they may not need. So we've found that 90% of the employers are offering benefits that only 10% of the people are using. With that, there's very low satisfaction in healthcare. So I appreciate you guys taking time to listen to me today, but we rank down there somewhere below Congress, we think, as far as consumer satisfaction. But our goal is to change that. And the reason that we've been able to do that is because we don't agree with what some of the insurance companies are doing. What the insurance companies have done over the past several years to try to quote unquote lower costs for group employers is they've increased deductibles. Now, a deductible is that first dollar cost that the member has to pay before the insurance actually kicks in and starts covering with some benefits. We have found that insurance companies have increased deductibles over 200% in the past 10 years. So that means that even though you as an employer are offering your employees coverage, it's coverage that they still have to pay additional for before they're able to get the full care from the insurance carrier. Costs are rising, and they're rising 4 times the rate of GDP. And the benefits that I'm going to talk to you about here in a minute are going to show you how we can change some of that. The great thing about partnering with HFA is we have plans that are available to everyone throughout the country. Medical, dental, vision, even telehealth options. They're all ACA compliant plans, which means they cover the pre-existing conditions. They have prescription benefits. And then the other great piece is that all this can be handled paperlessly. So in other words, from online administration to folks who enroll, getting copies of their insurance cards, all of those things can be done at the touch of a button. I want to talk first about our comfort level plans. And we have been able to put together these plans with the member in mind. I mentioned earlier that, folks are usually having higher deductibles offered to them, so those first dollar costs are actually on them, so they'll avoid going to the doctor. If you actually take care of those maintenance things over time, instead of waiting until they fester into something bigger in the future, you actually keep your claims down. So with these comfort plans, they're designed to limit the out-of-pocket expense that is added to the employees. So things like doctor visits. Now, your annual wellness is always covered at 100%, but if you wake up in the morning and you're not feeling well and you need to go to the doctor, that's going to have a $0 copay with our comfort plans. You can go see a specialist, and a specialist can range from a chiropractor to a mental health professional, dermatology, anyone that is within the national networks that these plans are part of. Folks can take advantage of those services with $0 out of their pocket. The other things that typically drive up the cost that folks avoid are their labs, x-rays, imaging, um, generic prescriptions, things like that. Those also are offered at $0 cost. The only time that you start getting into your out-of-pocket expense on these types of plans are if you went to an emergency room instead of a urgent care, or if you had some very, very high cost specialty drugs. And then the other part that would be on the member would be if they were admitted to a hospital or surgical facility. There's some cost sharing that goes with those plans. But the majority of the services that we all take advantage of, just regular maintenance, those are covered at 100%. If you don't fit into a comfort plan qualification, which there are some participation requirements, they're going to vary by where you guys are in the country, and we can go through that with you. We do have additional options. So the plans that Decisely is able to give you guys are not just a one size fits all. We have a national PPO, Blue Cross Blue Shield plan through Core Choice that allows anyone to go see any doctor within the Blue Shield network all over the country. It does not have a participation requirement. It's a guarantee issue group health plan. And then the way that it is structured, you as the employer actually do not have to offer a contribution. Now, it behooves one to go with the ACA requirements to offer 50% of the employee costs in order to attract and retain the quality talent that you want. But if you're not able to afford a contribution and this is a plan that your folks can take advantage of, then we can provide it for you. I'm really excited to tell you about this other option, though, the ICHRA. ICHRA stands for Individual Coverage Health Reimbursement Arrangement. And since that's a long thing to say, we call it ICHRA. And what that does is that allows your employees the freedom of choice. Throughout history, the group plans that are offered to the employees are usually selected by the employer, and they can take advantage of some options, 1, 2, or 3, or 4, depending upon your size. And those are the only things that the employees are able to enroll in. With an ICHRA, this allows the individual employees to take advantage of any plan that they want in the marketplace in their area. And they're able to enroll in that. And then you as the employer can give them a reimbursement for paying their premium on their individual plan. All of this is done very simply and easily through our platform portal, Decisely. And so whether it's the employee enrolling in those plans or submitting the reimbursement and then the employer doing their contribution to them, it comes all straight through our portal, very easy to use. The advantage to this is that the employees are receiving a tax-free reimbursement. I've talked to several companies across the country, and there's usually the smaller ones that oftentimes will just provide their employees with a monthly stipend for them to go out and purchase healthcare on the marketplace. That's something that you can do, but the ICHRA allows that employee to take advantage of that tax-free. So if you gross up their salary with a stipend, they're going to pay tax on that. Plus, you're paying payroll tax on sending that to them. This is a win-win for both the employer and the employee in that the employee gets a tax-free benefit and the employer also gets to write off a healthcare contribution. The great thing about how this all works is any of the plans that you choose to take advantage of can all be administered through our portal. Our portal is very user-friendly, very easy to understand, doesn't have a lot of jumbled pages. We'll take each person through their open enrollment page by page. And then once they've enrolled, they actually can go back into their portal anytime they want, and they can print ID cards, they can find physicians near them, they can look at their benefit summaries all at their fingertips. Could be a cell phone, could be laptop, desktop, tablet, whatever they utilize. What's great for you as the employer is this allows you to do all of your maintenance and administration in one spot. And our team is standing ready Monday through Friday, 8 to 8 to help you do that. We have bilingual, so we have Spanish speaking. We have folks that are part of the team that specialize in coverage counseling. So even when your employees are going through their open enrollment, they can call us or chat with us in real time. So if they have any questions about what benefits they're being offered. We get asked questions all the time, but we've narrowed it down to these big three. Number one, we get all the time is how much will it cost? The second one is how can I sign up? And the third one is what is the timeline for enrollment? So we have this partnership with the HFA, which we're very thankful to help you and your folks there. But we won't know what a group looks like until we underwrite it. Now, underwriting is very simple. Typically, it's just a census. We may take some information if you're already offering a current plan on your benefit designs and maybe what the rates are. And we'll take those out to our carrier partners and we will do underwriting. It usually takes a few days to get that done. So the underwriting is going to be based on each individual group. Although we are utilizing the power of the HFA as a whole and getting some discounts applied to that group, we really don't know what a group looks like until we have it through underwriting. How do you sign up? Well, I talked about that before. That's through our Decisely portal. Again, very simple and seamless. Our team will walk you through how to administer it, and they'll also walk your folks through how to do their open enrollment page by page if need be. Timeline for enrollment can vary, and it's going to vary based on sometimes the size of the group and if they have multiple locations and things like that. But typically, we will take a census and we will get it quoted, and that will take a few days. Once we get that quote back, one of our professionals or even myself will be able to get on the phone with you and walk you through the different options that you have, answer questions, and then there'll be a time where you guys decide which plans you want to offer your folks. After you've decided on the plans, we'll set you up in our system. We'll get you a call set up with our onboarding team and set up your open enrollment dates. Depending on the size of your groups, open enrollment could be a week, it could be 2 weeks. It just depends on how long that lasts. And then once you're enrolled, we'll have an effective date, and then you'll have your cards sent to each of the members in the mail, and they'll be live. We typically say that that timeline takes between 30 and 45 days. So in order to best serve you, it's good to have all the information that we can early on so that we can get it quoted and efficiently through. Here's how you do it. So you can look at this QR code here and scan that, or you can go to hfahealthcare.com and there'll just be a small form that you can fill out that has some information about your business. It'll typically ask who you are, who's the contact person there, how many employees do you have, and what state you're in. And then one of our specialists will be able to get back with you and set up a call with you and do a full needs analysis and try to find out what the best plan is that we can find for your group. Decisely's been doing this for a while. And again, we are very grateful to the HFA for their partnership. But as you see here, we have multiple large entities across this nation that we have put these programs together for. And we're very thankful for those as well. But at the end of the day, our goal has been to bring those Fortune 100 level, Fortune 500 level benefits to the folks that have not been able to. We're ready to help you. We look forward to speaking with you, and I thank you for your time.